Affecting people of both sexes and all ages, the urinary tract infection doesn't discriminate.
At any one time in the world, 2% of the female population will have a urinary tract infection.
At best, it's an annoyance. At worst, it can cause serious illness. UTIs go by different names depending on what part of the urinary tract is infected. Most commonly, it's the bladder.
Usually it presents with symptoms of urination, frequency, urgency, burning on urination, may even see blood in the urination. You might have a fever, might not have a fever.
More frequent in women because of their anatomy, the infections are caused by any number of bacteria.
The most common is E. coli. About 85% of all urinary tract infections are E. coli. And actually about 85% of an uncomplicated urinary tract infection will respond to sulfa if the person doesn't have an allergy to that, it usually responds.
A short course of antibiotics is usually all that's needed to clear the infection, but for some people it isn't that simple.
If there's any problems such as they're also diabetic or they have a problem where they've had some previous surgery in that area, you may want to run it a little longer. There's other infections that won't go away over a period of time that you have to run for maybe 3 or 4 weeks. Another subset of people who develop urinary tract infections so frequently that we actually put them on a suppressive, what we call a low-dose antibiotic, something to kill the bacteria, but not necessarily be a heavy antibiotic.
If chronic infections are untreated, it can result in scarring of the bladder or kidney. So while UTIs are a common complaint, it's important to take them seriously. For Lee Memorial Health System, I'm Amy Osher.